You've heard of the pill, the ring, and that T-shaped device inserted under the skin of the arm before. You remember them being mentioned in high school PDHPE classes. Now you're an adult making your own decisions. Before discussing contraception, it's important to have an understanding of normal female reproductive physiology. During a normal menstrual cycle, the hypothalamus secretes gonadotropin-releasing hormone, which stimulates the anterior pituitary gland to release two hormones. Before discussing contraception, it's important to have an understanding of normal female reproductive physiology. During a normal menstrual cycle, the hypothalamus secretes gonadotropin-releasing hormone, which stimulates. These are follicle-stimulating hormone, which promotes growth and development of responsive follicles and allows for estrogen production, and luteinizing hormone, which surges during ovulation and stimulates progesterone production from the corpus luteum to prepare the uterus for a potential pregnancy. These are follicle-stimulating hormone, which promotes growth and development of responsive follicles and allows for estrogen production, and luteinizing. Contraceptives prevent pregnancy by interfering with at least one of these physiological processes. This video will discuss 3 hormonal contraceptive options available in Australia: the combined and mini oral contraceptive pills, the intrauterine device or the IUD, and the vaginal ring.
Hormonal contraceptives can be broadly classified into 2 types: progestin-only methods, including the intrauterine device, and combined methods containing both estrogen and progestin, which include the combined contraceptive pill and the vaginal ring. Hormonal contraceptives can be broadly classified into 2 types: progestin-only methods, including the intrauterine device, and combined methods containing both estrogen and progestin, which include the combined contraceptive pill and the vaginal ring. Hormonal contraceptives can be progestins or synthetic progesterones are the main hormone in contraceptives that prevents pregnancy. They can alter the normal hypothalamic pituitary ovarian axis through 3 ways. 1. Suppressing ovulation. As progestin suppresses gonadotropin-releasing hormone, it decreases luteinizing hormone levels, so the surge needed to stimulate ovulation isn't reached. 2. Thickening cervical mucus to prevent fertilization. Progestin increases the viscosity of the cervical mucus, causing sperm to be trapped in the fluid, making it harder to enter the uterine cavity and fertilize the oocyte. 3. Thinning the endometrium. Additionally, progestins prevent growth of the endometrium, keeping it thin throughout the menstrual cycle. This reduces receptivity to implantation, but hormonal contraceptives are primarily understood to work through the other 2 mechanisms of action. Meanwhile, synthetic estrogens support progestins in suppressing ovulation by providing negative feedback to the hypothalamic pituitary axis, reducing GnRH, LH, and FSH secretion to suppress follicular development. Now, let's do a rundown of the physiological basis for each. Meanwhile, synthetic estrogens support progestins in suppressing ovulation by providing negative feedback to the hypothalamic pituitary axis, reducing GnRH, LH, and FSH secretion to support. The combined contraceptive pill contains both progestin and estrogen, preventing pregnancy primarily by suppressing ovulation, but also by thickening cervical mucus to reduce sperm penetration and thinning the endometrium. Meanwhile, the mini pill contains progestin only, preventing pregnancy by thickening cervical mucus to inhibit sperm movement. However, some formulations of this mini pill can also suppress ovulation. These pills are taken every day at the same time, making it highly user-dependent. The vaginal Nuva ring is a single-use soft plastic ring containing both progestin and estrogen that is self-inserted into the vagina each month to suppress ovulation, thicken cervical mucus, and maintain a thin endometrium. It is worn for 3 weeks and removed for the 4th week, repeating every month. The vaginal Nuva ring is a single-use soft plastic ring containing both progestin and estrogen that is self-inserted into the vagina each month to suppress ovulation, thicken cervical mucus, and maintain. Lastly, the hormonal IUD is a plastic T-shaped intrauterine contraceptive device, releasing progestin into the vagina to thicken cervical mucus and thin the endometrium. Ovulation is not entirely suppressed, especially in the first year. This contraceptive is surgically inserted, and depending on the device, it can remain effective for 3 to 8 years. Lastly, the hormonal IUD is a plastic T-shaped intrauterine contraceptive device, releasing progestin into the vagina to thicken.
All 3 forms have advantages and disadvantages based on effectiveness, side effects, reversibility, cost, and protection. Hormonal contraceptives generally have high rates of effectiveness. With perfect use, all 3 methods have an effectiveness of over 99.5%. In typical use, the pill is the least effective due to its high level of user dependence. Users may forget to take the pill or at consistent times or experience vomiting, reducing effectiveness. The ring comes in second as it has lower user dependence, requiring self-removal and insertion. However, the risk of expulsion decreases effectiveness and user compliance. Given that the IUD is the least user-dependent, requiring minimal maintenance once inserted, it has similar percentage of effectiveness for both typical and perfect use. However, shift from the correct position or infection affect the effectiveness. A major disadvantage for all 3 forms are the estrogen-associated adverse side effects involved, such as dizziness, headaches, mood changes, nausea, and breast tenderness, and also venous thrombosis due to these causes. It's important to note that the hormonal delivery method of the ring and IUD through the vaginal epithelium is advantageous as there is low systemic estrogen dose. However, the ring being user-dependent on insertion, there is a higher risk of vaginitis. Similarly, due to the IUD's invasiveness, uterine perforation or pelvic inflammatory disease can occur. Fortunately, the mini pill can be an option for those wanting to avoid these side effects, as it is a progestin-only oral method.
Cost directly influences accessibility, which can affect how consistently a contraceptive is used. The pill and vaginal ring have lower upfront costs, making them more affordable to begin with. In contrast, the hormonal IUD requires a larger initial payment and an insertion procedure. However, because it provides 5 to 10 years of contraception, it becomes the most cost-effective option over time. A benefit to all the contraceptives mentioned above is that fertility can return quickly after stopping usage, reversing actions which suppress ovulation, fertilization, and thin the endometrium. Generally, after removing an IUD, pregnancy can be attempted within the first month following removal. Conversely, with the vaginal ring and combined contraceptive pill, ovulation begins 1 to 3 months after removal or discontinuing medication. With the mini pill, fertility returns as soon as a few days after removal. A major limitation of all three contraceptives is that they do not offer protection against STDs. For effective protection against STDs, physical barrier protection such as condoms and vaccine treatments are recommended. Understanding the female reproductive physiology helps explain how contraceptives work to prevent pregnancy. Each method, the pill, the IUD, and the vaginal ring, have its own advantages and disadvantages and levels of effectiveness. So the best choice will depend on the individual's lifestyle, health, and personal preferences. Choosing the best contraceptive should always involve informed discussion with a healthcare professional.